Shortly after being elected, we did, together with with one particular health region, participate in a recruitment mission to the Philippines and attracted a number of nurses. I think it was over 500 nurses that were attracted to the province. In addition to that, we soon after getting elected, we signed a new deal with our nurses, both for the collective bargaining agreement that was needed, but also a part of that, well, actually just ahead of that collective bargaining process, we signed a new partnership with nurses, a $60 million government investment in recruitment and retention, because you're right, retention is key. And I want to say there's some signs here, the very positive signs. I think the pass rate for international nurses passing their test here in Canada is about 61%. I can tell you the number for Saskatchewan, these new nurses to our province, is 81%. So there's I mean, some will want to go home, you're right, and not everyone will pass the test, but our numbers are doing very well. I credit our healthcare officials and the regions themselves, and the minister, I think, is doing a good job, and it's still an issue. And I would add this, we also need doctors in the province. And so very recently, the Ministry of Health announced the Physician Recruitment and Retention Initiative, which we hope will be as successful as it has been on the nurse side, knowing that there is still more work to do with respect to all frontline healthcare workers on the recruitment and retention side of things.
The province's healthcare budget, of course, is the biggest chunk of the overall provincial budget every year. Are there 2 or 3 healthcare initiatives in the current year budget that sort of stand out in your mind as being worth watching for future results?
In the last 2 budgets, and you're right, this budget had about a $330+ million increase, 8.8% increase in the healthcare budget, and it is close to 40% of the whole budget. In the last few budgets, we've been focusing on more so the first one of our government than the second one, but the keeping our promises with respect to investments in the cancer agency and with respect to adding some important drugs to the formulary. I think we're interested to the approved government plan, I should say. So we're interested in watching the result of that. Right now, what's underway in Saskatchewan is something we call the Patient First Review. I think the first time, for the first time in Canada, we're doing a review of healthcare, but not a blue ribbon panel that travels around and perhaps just meets with stakeholders. We want the patient perspective. Do we have the administration versus frontline care ratio right? Are we missing some things that are maybe some not? There's no easy answers here, but are we missing some ideas that patients are providing if we would but listen to them? So Tony Dagnoni's been asked to do that review. We'll be getting reports back. That's an important development on how we can improve health care. In the last budget, finally, I'll say, we've ended the dubious distinction of being, I think, only one of 2 provinces that does not have a children's hospital. We've moved on that. We've kept a campaign promise, and there will be a children's hospital here in Saskatoon, and that's an important healthcare development as well.